going to take the video off.
Hi,
Hi, Mona.
Yeah,
Good
hi.
to see you.
Looking forward to this. It's very exciting. It really is.
Okay, I'm gonna hit broadcast, and so folks will start joining, and we'll just give it a couple minutes until most of the folks are in.
So, all right. Perfect. Hello?
Yeah.
Okay, you're still there. All right, just checking.
Yeah, I think we can go ahead and get started. Welcome, everyone.
Good afternoon. Welcome to the fourth session in the September CME webinar series offered by the Medical Society Consortium on Climate and Health. I am Dr. Caitlin Rubley, an emergency medicine physician at Medical College of Wisconsin, and will serve as the moderator for today. The next 10 years is a critical window of opportunity to avoid the worst consequences of the climate crisis. To meet this challenge, national medical societies, in partnership with state medical societies, public health, nursing, and other health professional societies, have come together with the shared conviction that climate change is a health emergency that must be overcome. The consortium also welcomes individual climate and health advocates. Sign up on the website docsforclimate.org. Our shared goal is to create a future where all people have clean air, clean water, and nutritious food, and where the climate has returned to a stable state. This webinar is part of a series of 4 webinars for credit that the consortium is offering during the month of September. This is the final webinar, but we invite you to review previous webinars from the month. Before we get started, some housekeeping items. Please place your questions into the question and answer space. We'll pose them after the speaker has finished. CME credit is available for the webinar. The link to the CME questions and certificate will be available in 3 ways. In the chat immediately after the presentation, it will be posted on the website under learn/CME and in an email. Presentations will be available on the consortium website, and an email will arrive after the webinar with links. I want to thank our support, Colin Ackerman, for running the Zoom today. And now for introducing our speaker.
Oh, Caitlin, I think you got muted somehow.
All right.
There we go.
We should be good. So Dr. Alexander, again, is clinical professor of physical medicine and rehabilitation at the University of Alabama. She has co-authored the international standards to document remaining autonomic functions after spinal cord injury. She is consultant with the Spalding Harvard Spinal Cord Injury Model System and has conducted a substantial body of research documenting the effects of spinal cord injury on sexual response in women and men. Dr. Alexander is on the editorial boards of Spinal Cord, Journal of Sex and Marital Therapy and Sexuality and Disability. She is the past president of the American Spinal Injury Association and also past vice president representing North America for the International Spinal Cord Society. Without a doubt, she is an amazing advocate for her patients and for physicians. And so without further ado, we are so excited to have her today and look forward to her presentation.
Hi, everyone. Am I sharing now?
Not yet.
Okay.
Yeah, I'll stop sharing so you can pull yours up.
All right, did it come out?
No, not yet.
I guess I pressed share screen before you did. Sorry, everybody. In the meantime, I'll start talking. How's that? All right. Am I sharing yet?
No, did you go to the bottom of the Zoom window and hit?
Yeah, I did it before.
Yeah.
Okay, so I'm going to start talking before we share. And I apologize, everyone. So
There we go.
as life goes on, we all take on different roles. And I've done a lot of work in spinal cord injury, but I've realized as I've gotten older that my most important work that I need to do is still to happen. And what I'm talking about is the issue of climate change and disability. And I really apologize for this not wanting to work because my computer is over here. All right. We all need to learn this. So one of the things that's important more,
If you hit the slideshow at the
I can't get to the slideshow button, that's the problem. I have to be able to drag and it's not letting me drag. So I'm just gonna start this way and I also can't. Here you go, slideshow.
yeah, there we go.
All right, am I now shared and on slideshow?
Yep.
All right, so this is me and I'm gonna talk about climate, health, disability, and equity. And these are my disclosures. Really what I do these days is I work for a nonprofit, which is as unfunded because all of our members are volunteers around the world. And I've done a lot of work in terms of sexuality and disability. So what's important for you to know now? Why am I here? What are we talking about? And why did I decide to stop working in medicine and start working solely in climate change? And the bottom line is that I agreed to give a lecture once on, well, not once, after a long time of trying, we got the ability to give a lecture on disasters and climate change and disability. And when I was looking together to put my lecture on, I realized that there's nothing out there. Nobody pays attention to people with disabilities in terms of extreme weather. No one pays attention to people with disabilities in terms of climate change. And I really started thinking about this and what my role needed.
Dr. Alexander, I think you're muted.
Okay, I got it. You haven't heard me at all. So you've seen my slides.
No, we heard you just till a couple seconds ago.
Oh, okay. All right. So in terms of disability and climate change, I realized that people really aren't talking about it. So I decided that this needed to be what I did. And I quit my job, my full-time job in 2019, and came up with this, I guess, relatively brash idea that I would walk from Canada to Key West, just to highlight the issues of extreme weather and climate change. And along the way, I stopped and gave rounds in a number of places. So today, our specific objectives are to share with you information that I've already shared with others, but also to highlight it in your mind. What are the specific vulnerabilities of people with disabilities, and what can we do to take care of people with disabilities? And I think in this time of coronavirus, this has become so much more important because we've seen what's happened in nursing homes, and people with disabilities are similar to the elderly in that they are in nursing homes. And this population is really, when we think of climate justice, another group we've got to think about. So along the way, what I meant to do was to, if anybody knows how to get rid of this black bar, I would send you a kiss online, but I can't get rid of it on my screen. So this is a lady I met in Maine, walking on the road. And what I actually did was, you can see my husband in the background. I kind of walked on roads, and you'll see there's no sidewalks anywhere unless you're in a city or you're in front of an establishment that makes money where they'll tell people to put in sidewalks. There's no sidewalks. And I saw this lady and I thought, God, she looks like she had a stroke. And she's walking down the road and she's got cars behind her. She looks so vulnerable. And she actually talked to me, and we talked a little bit about climate change, and she walks every day, and she said, no, I didn't have a stroke, I have Parkinson's disease. And you can just see this lady walking down the road and how unsafe it actually is. And that's kind of, you know, what you see is that you will see people with disabilities, they're very infrequently outdoors, but when you do talk with them, they are noticing what's going on with climate change. We know there's one person in the world that's very famous in terms of having a disability and being adamant about climate change, and that's Greta Thunberg. And I guess my hope would be, as adamant and what a great, incredible advocate Greta is, that other people with disabilities will follow her lead. This year, there was a man in, not this year, last year, the first time there was actually somebody on the press from Hurricane Dorian, and you can see this gentleman who's clearly visually impaired, and there was a story about how he was carrying his son with CP during the hurricane. So news and the word is starting to get out there, and it is good because the United Nations just declared disability and climate change a human rights issue. But we've got a lot of work to do. The other thing is, when we think about disability or the elderly, you know, we often think about leaving our children in cars. And we know that if you're in a hot area, when you're in a car, it's much worse. And for those people in emergency medicine, you're only too well aware of this. But this is also something that is an issue for people with disabilities. So it's not just the disasters, but what happens slowly. You all know the effects of climate change on health. We've got increased deaths from extreme temps, increased cardiac disease, respiratory disorders. Then with increased temp and rainfall, we've got infectious disorders. Saline intrusion causes water and soil contamination, and our toxins and pathogens will increase. Flooding causes drowning. We've got our vector-borne diseases, issues with standing water. We know anxiety and depression is an issue, and then we've got waterborne diseases. Late last year, we put together a study to really start getting people's experiences from a professional standpoint on what is going in the field of rehab. As you know, I specifically have a lot of background in spinal cord injury, so this was done in a spinal cord injury cohort, actually a cohort of professionals around the world. So we interviewed 125 professionals, and you can see the continents they were from. Most of them were physicians, a small number of physical therapists, and getting an impression from these professionals, I think, is meaningful. The majority said yes, the climate had changed, and of those that said yes, 70% thought there was an impact on their patients' health. These were people from diffuse environments, Mostly the extreme heat was a problem, but even people in our northern countries had an issue. And you'll see that half of our respondents had experienced a weather disaster. They felt their effects on patients were primarily related to the temperature, dehydration, fatigue, respiratory issues, mood, and access to care. It's interesting, only 25% of these professionals had educated patients about disaster prep. And I think this is an important point to take home, because people that have new disabilities, they really need to think about, what do I do if there's a disaster? Now, this was done in 2019. Only 28% of the group had used telemedicine. And we see how telemedicine has become so important in terms of Corona. 82% thought professionals should concern themselves with sustainability. Surprisingly, there were 2.4% that didn't think it was an issue. And I think it's interesting that, of course, they were both from the US. And 64% did consider sustainability when treating their patients. In terms of their preparedness, providers gave themselves a 3.16, with 10 being extremely prepared. And in terms of their patients, they gave their patients a 2.55. So not feeling like they're ready for what's happening, but 85% were interested in more information. And this is what they wanted information on. They wanted patient information. What do you do in extreme temps, disasters? What about for providers, sustainability? What about telemedicine? Advocacy was still 40%, which is nice. Climate change was 30%. So what are we doing to follow up? That was a very short, sweet, primitive study. But right now I am working with some professionals from around the world, and we're putting together an international controlled survey of people with various disabilities. And we want to create an ongoing database. And the idea is we'll get a cohort of people with disabilities of all types, and also get their able-bodied neighbors to respond and assess, what's going on with time with these people, and what group of people are the most vulnerable, also what can be done. I think one goal we have is really to make people with disabilities realize climate change is an important issue. So what do people with disabilities need in extreme weather? One thing is they need knowledge about what to do. If you think about Katrina, or you think about Sandy, a lot of times people with disabilities are not knowing what to do until it's too late. If you hear that you've got to evacuate after the subway's been turned off, that's not helpful. People with disabilities have special needs. They need more time. They don't know what's happening. We don't always learn things. And one thing is we don't have infrastructure. Some places have better infrastructure than others, but this is a key problem, and there have been legal battles about it. And community planning and support is a key issue that needs to be out there. For those of you that have a chance, there's a nice little video called The Right to be Rescued, which really delves into these issues. All right. So in terms of disaster preparation and disability, what do we need to be doing for people? And if you're an ER doc, this might be, handing out information in an ER. If you're a rehab doc, thinking about what your hospital does for this. And if you're, if you're in private practice or a primary care practitioner, you might think about this for your disability population. This can be done as an inpatient or an outpatient. The key is people need a list of their needs. Just like able-bodied people need to prepare for disasters, people with disabilities and the elderly need to do so, but they need to do so even more importantly. They need to write their needs down, how they're going to be met in the disaster, be proactive, think about their activities of daily living, mobility, equipment and supplies, realizing electricity. I happen to be in Louisiana right now. And, if we think about electricity, the obvious is, oh, people go out and get a generator, but what about sustainable electricity? What about solar panels? Let's get some backups going here. What about water? Do they have their water supplies? What do they do if their accessible transportation isn't available? And what about a caretaker? One of the biggest difficulties with people now in terms of coronavirus is the issue of your caretakers coming from the outside. You know, how do you know what they've been dealing with? And all of the issues of social distancing, equipment, hand washing. How do we deal with those things? What about elevators, ramps? What happens to equipment people have if their sprinklers go off? So really, if we're able-bodied, it's a key to think about what your life would be like if you had all these extensions outside of you that you couldn't feel and you had to clean and take care of, but couldn't do on your own. One key is how do you help somebody that's in a wheelchair? And I think this slide is important, and I was helped by someone who I'll show a picture of later in putting this together. Ask the person first how you can help. Unlike in this picture, you're not supposed to lift a person in the chair. The person goes separate than the chair. Just like for Jaco, the chair can't be blocking entrances. And then you've got to think about service animals. Make sure they stay with their master, but also make sure the chair stays with the person. This is an important point. It's something to think about if you ever get in this situation. So in terms of disasters, I'm talking about disasters, but disasters are not the only issue that comes on. And I want to share with you a video, if this will work for me, of a fine gentleman that I know with a spinal cord injury talking about the climate. Oh. Sorry.
Yeah, I don't think we can hear it, Dr. Alexander, sorry.
Okay, thank you for saying that. All right. So what Chris is basically saying is that he has a spinal cord injury, and you can see that he's young and he's active. And in fact, Chris just went, he's got a C5 level of injury, and he can move his arms and legs a little bit, but he's primarily in a wheelchair, yet he's independent and can direct people to help him. So he needs assistance, but he's independent. And one thing is that Chris loves the outdoors, but people with spinal cord injuries have an issue that most of us don't think of, and that's poikilothermia. You know, being like a reptile is how I might explain it to people. They can't be outside in extreme cold. They can't be outside in extreme heat. And so if you're somebody that's outdoorsy and the climate is changing, you're basically stuck on lockdown, even though you don't have corona. And so this was something Chris recorded a year ago. And so already on a day-to-day basis, the way the weather is changing, the way the climate is changing, it's causing quality of life concerns for people with spinal cord injuries. Other concerns that come up for people with profound disabilities, you know, people with MS, people with ALS. When we've got day-to-day weather changes, what about equipment needs? What do you do when there's a snowstorm outside and you've got a wheelchair? What do you do when there's a bomb cyclone and you're now having problems with the heat when your body, when you don't have the normal mechanisms? What happens when it's hot and humid and you're in a wheelchair and you've already got skin problems? And then what if you need a caregiver? So these are special concerns with people that have profound disabilities. But again, as Chris says, it's not just the severe issues that happen, it's the day-to-day issues. So people with, disabilities also have the double whammy. They are often poor. Just being disabled makes it that you usually don't work. So being unemployed and being disabled, you are doubly at risk in regards to migrating for temperature issues or flooding issues. You don't have the money, you might be pushed away quickly, and you don't have the means to do so. When you finally get in your niche and you're able to survive on a day-to-day basis, it's tough to change that. We've got the extreme temperatures resulting in imprisonment at home. Honestly, when I walked, so far I've walked from Canada to North Carolina. I have seen about 20 people with wheelchairs outside. And you think about it, well, if it's 100 degrees, as it was when I was in Boston, people that are able-bodied are not going outside. So imagine if you had a disability, it's twice as difficult. Again, we said the issue of decubiti. And then if we think further, what about the issues of new pathogens and what happens with those? These will affect people with disabilities too. If we look at the climate change refugee map and these areas, and we start thinking of all the people with disabilities in this area, it becomes more and more meaningful and important to think about this. And in fact, as I have transitioned in terms of what I do, I kind of live my life more like a Star Trek life now and deal a lot with people with disabilities and their providers around the world as opposed to just in the US. So right now I'm very concerned about the Darwin effect. As we've seen so many social justice issues these days, I fear for people with disabilities and the elderly. The nursing home issue has really highlighted this in the US. And as we've had COVID, and yes, we've had so many people hospitalized, but so many rehab places have gotten repurposed. And there's been talk of people with, prioritizing who is important, who isn't important. Well, what if you already got the ventilator on board and people are trying to take it away from you? There's a significant amount of research that shows that even though people are disabled, their quality of life is really still good and they are just as happy as people that are non-disabled. And then as we go forward though, what I really am concerned about is the issue of children with disabilities, because children with profound disabilities, as time goes on, they may not have their parents to take care of them. Right now, we're all too busy, they're all too busy learning to take care of themselves. And as time goes on, they are going to be even much more vulnerable than people now. And I might say, in terms of this whole issue, people might say, well, I don't know anybody disabled. It's not a big deal for me. But as we all age, we have a good chance of being disabled. And in 20 years, climate change will, unfortunately, likely be very worse. So we've got to pay attention to this. I apologize so much for my slides. So what can we do? What are the steps we can take? My glass needs to be half full, and I hope everybody else's is. So what can we do to improve the healthcare of people with disabilities and decrease the environmental impact? Well, I'm a big lover in telemedicine. It's environmentally sound, and think of all the miles we save using telemedicine. It's also obviously good for infection control, et cetera. What about the way we treat patients? How about less medicine? How about increased use of integrative techniques such as yoga, mindfulness, Tai Chi? Disposable supplies is another issue. In my journal, Spinal Cord Series and Cases, we have a point-counterpoint coming out about using reusable catheters versus single use. For those of you that have been in medicine for a long time, it has in some ways changed better, in some ways changed worse. I think, we have so much more waste now than we used to. We do things with electricity now that we used to do without. And so we need to figure out, maybe we can move that pendulum back a little bit, just like we did with the opiate crisis, and get to be more organic, more sustainable in the care we provide. Even adult diapers. How many adult diapers are used? Can we do something better? We don't make patients aware of the impact of waste. We don't emphasize sustainability. We don't emphasize recycling and packaging. This is important. And recycling of equipment. All these things are very important to think about in the long run. And for young people, these are areas where we can do incredible work. All right. What about plant-based diets? People with spinal cord injuries have bowel routines. In my family, we've tried to get away from eating beef. We know that the values of eating plant food and are changing our diets. Well, this would be a great thing for people with bowel routines. Might be a good way to help them get off of taking regular suppositories, taking regular stimulants. And, you know, they come in packaging. So again, we're just thinking sustainable versus unsustainable. What about solar powered equipment? There's not a lot of solar powered equipment out there now for people with disabilities. I used to be against cell phones for everyone, but now cell phones I think are an important thing. And why? Because of telehealth. If you had cell phones and you could have telehealth and online learning with your cell phone, that would be a great thing. And fortunately, fortunately or unfortunately, in some parts of the world, people will have cell phones but not have floors and not have running water or not have toilets. And we have actually tried to capitalize that in terms of educating people, which I do think is something we can think about for the future. Off-the-grid energy sources. You know, every time there's a hurricane, it would be great to rebuild with off-the-grid devices. What about cooling clothing? There's something called smart wheels for wheelchairs where you push them, and by pushing the wheelchair, you get a battery going, and so you can go faster without having an electric chair, or you can go further. Well, what if we did this and made it solar-powered smart wheels? Homes ready for extreme heat and floods. This is, you know, just something that everyone needs to do. Fewer electric beds. When I started practicing in spinal cord injury medicine in 1986, we gave people foam on top of their mattresses. Now air mattresses are everywhere. Greater accessibility of our physical and virtual environment, as I talked about in my walk, and just a focus on sustainability. I think these are all things that we can do and that we need to do. Getting prepared for the future is a matter of moving forward, thinking forward. So, you know, I'm passionate about sustainability. And one of the things that we've done, which I want to mention is, I want to mention the things I've done in terms of advocacy as I've kind of changed my life. One of the things I've done is started a concept of the Day for Tomorrow. We are actually having Day for Tomorrow again this year soon. And what we did was we had walks in different cities, and you'll see a number of these slides. But the idea of Day for Tomorrow is, well, how do we prepare for the future? And really, it's about community. Regardless of where you are, if there's a disaster, community is an important way to get help. So last year, as I was walking, there were Day for Tomorrow celebrations in a number of places. This was in Moshi, Tanzania, which I'm very excited about. In fact, you'll see another picture from here. And we had celebrations that went on in New York, in Chapel Hill, I was in DC. And the idea is get Day for Tomorrow out there. And so I did this walk, and I walked about halfway, and then I realized that the best way to do this was to break things up and go to where I wanted to find people with disabilities that had disaster experience. So I was fortunate enough to meet Gretchen Dillon, and Gretchen is actually a psychologist who had a spinal cord injury while she was at work. And she was president of the Spinal Injury Association in Puerto Rico when Maria came out. And she had helped a number of people with spinal cord injuries around the country. And she was so kind as to take me around Puerto Rico and let me interview some people with spinal cord injuries and actually see some of the advocacy people with disabilities do in Puerto Rico. And I was able to get Gretchel. Gretchel gives lectures on how to prepare for disasters. So I was able to get Gretchel to tape a lecture in English, and also she's doing another one in Spanish for people on how to prepare for disasters. So again, it's key is to get the word out, to get people involved. So I had done all this work and wanted to really do something with telemedicine to help people. And by 2020, Corona took over our world. And so I was talking to one of my colleagues in India, and we were trying to think of what the best thing to do was to help people. And I'll take you to what we decided to do now, which is we started a YouTube channel where we are on 5 continents, and we are doing programming for free for people with disabilities. I'm just going to take you there for a second because to me it's a new model for what we can do. Hopefully this will come through. Not going to play a video, but well, I guess you'll see it. There is a video here. We have some videos on people with disabilities that are providing their information. We have, we actually have over 40 pieces on the channel. You can see all of them. We've got people from other countries, and we're doing a program tomorrow on telemedicine around the world. We've got some videos on fall prevention. We've got a thing on disaster preparedness, and another focus on climate change too on the channel. I'm not sure which one it's going to come in up, but there's one on climate change. So what we decided to do was take our education, take our care online, because it seemed the thing to do. Doing one-on-ones with telemedicine became second nature with Corona. And the question was, how can you help people the most? And so this idea actually came from my colleague in India, and we also have a group in Nigeria. And the issue is, let's get equality out there. Let's help people. Let's educate everyone. So our mission really is twofold. It's to talk about disasters and disability. And that's why we have Day for Tomorrow coming up. And then it's also to educate people. Because what I've found is that some health professionals might get involved because of the concept of education, whereas others might get involved because of the issue of climate change. So what I want to do is bring everybody together. So more is better. If you go to our website, you'll see all the continents we're on. And we're all doing Day for Tomorrow together. And I'm happy to say we do have one speaker, solely not disability related, who is Mike Millen, who is a former mayor of Seattle and is the CEO of Walk America. And we're going to show videos and have people talk from 5 continents over the day about what they do for disasters and disability as a way of sharing. So would be happy to have all of you join us if you can. We're going to start in the daytime on the East Coast, and we're actually going to end in the daytime in Japan, which will be our last presentation. And we're also happy we've gotten some children that have gotten involved, and they're doing a really cool program on climate justice. So the idea is that there's a way we have to go forward. We've all got to work hard. I have to view the world through rosy glasses. Friday night last week, I happened to be in Costco when the news came out, and I literally started crying. And one of my colleagues in the group who's from Seattle, a young doc, she actually texted me too, and we were just, both so devastated. And then, I felt like, well, I happen to be in New Orleans, and I felt like I couldn't really just talk to anyone, and because I didn't know what I'd hear. So we've got to work together. We've got to work on sustainability. We've got to get out as physicians and healthcare professionals as advocates. And I know we're all busy. And, you know, in 2000, I was in Florida. And you know who I would have voted for, but I had 3 kids. I worked as a full-time doc, and I was super busy. And I just think now that if I had gotten out, and I actually didn't vote, and that's probably one of my biggest regrets. But I feel like now the more important thing would have been if I had gotten out there and really been an advocate. So we've all got to do this together. I hope you please get inspired a bit. You can follow what we're doing on YouTube, Facebook, Instagram, and Twitter. We've got to be positive, have those rose-colored glasses, and do what you can. You know, people in healthcare go into healthcare because they love people. And, you know, we work so hard, and especially these days this year, you know, we're all so stuck in what we do, but right now, more than ever, I think this is the time when we've all got to pull back a little bit and say, okay, how can we help our country and the future of all our descendants? So thank you so much for listening to me. And I'm going to click and hopefully, I apologize for all of my things. Do I need to stop sharing? Yes.
All right, thank you so much. That was wonderful. We have a bunch of questions coming in, and so I'm going to start posing them to you. The first is from Michael Wright. He says, many disabled elderly are members of AARP, which has a significant voice in policy decisions. Is the healthcare community that is concerned about climate change collaborating with these organizations to help better inform the elderly on this issue that not only affects them, but also their children and their grandchildren?
Well, I think that's a great thing. And, you know, I'd probably ask you guys that question because you've got a lot more power than I do. I'm just sort of starting in this. But I think, yes, I think that's really important. And, you know, to be honest, I've tried to write and get pieces that people would have an interest in, but it is slow. We need to get more people interested in this. We need to get, you know, like a celebrity that has, you know, an interest in climate change and has disability. I mean, I think of somebody like Neil Young. We need to get people out there that take this on too, because it is a large population. If you realize that depending what you look at, 1/4 to 1/5 of people in the US have disabilities. If we get all the people with disabilities out there and we mobilize them, that would be great. But the issue is that I've been told, and you know, one thing is nothing about us without us, and I am not disabled, but I do try to include people with disabilities as much as I can in my work. But one issue is that people with disabilities are very, they're struggling to get through day by day, just like people that are, you know, homeless, people that are poor. And I don't think they have knowledge of the bigger picture. So I think this is something we all need to work on. And yes, AARP would be wonderful. Mona, if you have any comments, we'd love to hear your comments too.
I think it speaks to the power of organizations as well. Maybe Mona, you can speak about that.
Yeah, happy to. This is really interesting, and I feel that so many more people need to hear this presentation and to think about some of the issues that you're raising, and you know, and what they can do. You know, and this presentation, of course, will be posted on our website and be available, and you know, we'll continue to promote them, and so others will be exposed to this. But I'm thinking that we should also be finding other venues for this discussion. Perhaps this could be one component of our annual meeting. You know, perhaps some of the blogging and other things that I know you do. Marcalee, you know, thank you so much for all the work you're doing. You know, you've just really been out there speaking to people and making these issues known and trying to bring the community together, and that in itself is hugely important. But yeah, we look forward to trying to promote this area of understanding to a much greater extent than is currently out there.
Next question. Are there discussions out there to use telemedicine systems to reach people for heat and other climate weather hazard warnings?
So in some small places there are. And the thing is, everything is more community related. And yes, that is a great idea. That, in fact, was my idea in terms of the nonprofit I started. My goal was to, rather than go to disaster areas, to use telemedicine. And interestingly, telemedicine is used, and there are some international nonprofits that will do telemedicine to other countries. And more it's getting out there in terms of the issue of disaster. But that is, for news, that's definitely an area where you could, do work and expand and share with others. I mean, as I look at this, it's like almost any direction you want to go into, if you're a young person and you want to develop, I think, yes, that would be a great thing to do. I did want to do that for people with disabilities. And I will tell you, I reached out to an international organization, International Society for PM&R, and I'm on the disaster committee. And I brought up telemedicine and climate change. And the chair of the committee said to me, I never thought about climate change and disasters because they're all so in tune to earthquakes and physically going to an earthquake. Although we will have tomorrow, we do have a presentation from, if anybody has the time to watch our presentation tomorrow on telemedicine, between 8 and 12, it's going to be on Sustain Our Abilities, our channel. There is a presentation from someone in Nepal where they talk about using telemedicine in earthquakes. So there's a lot of different telemedicine presentations from around the world, not telemedicine, telerehab, because I focus on rehab, so this is a group.
There's a question about what is cooler clothing?
Well, does anybody have a chillo? So I guess you're not as old as me. There's a certain phase in women's lives when they want to be cool. And so there are pillows that are chillos, and there are, I guess there's even mattress toppers that are, supposed to be chillos, and they're not electric. And so my concept would be, what if you can have clothing that keeps people cool? I'm sure somebody's probably done something about it, but I think the sky's the limit here. We need to figure out, what to do. What about an umbrella that has solar panels on top of it? What about some of these things that just can make life easier, but also be sustainable in and of themselves?
The next question, I think they're talking about day for tomorrow, consistently on October 4th.
So we had Day for Tomorrow last year on September 22nd. That's because we were in DC. We haven't named the day for next year. We try to avoid the holidays, but also be at the same time of the year. I would tell you there's another organization in Boston that I would love to share with you that we do collaborate. It's called CREW, Communities Responding to Extreme Weather, and they have their festival this week. And then New York has their climate festival. We kind of picked the day September 22nd last year because it was the day before the UN summit. And we got October 4th this year just because of the Jewish holidays. So it's not consistently then, but it will definitely be around the same time, probably, maybe the 3rd next year. We try to make it on a Sunday because Sundays are days when a lot of times families will get together. And the idea of community, I think, is really important. And, I love Earth Day. Earth Day is wonderful, but I think we also could have another day during the year. And, sadly, as I think about the future, I can't help feeling like I live on a young Venus. The Earth is going to be here. The question is, what's going to happen to humanity?
You talked a lot about incorporating the voices of people who have disabilities and their journeys. There's a question about how we find those people interested in speaking in order to engage them within academia and our community presentations.
So I do have a number that I have recorded. If you go to the channel, there's a really good one of a woman named Peg Nosik. I've got a number of people with disabilities that have been that are on our board now that would be happy to speak up. There's not a other specific way. We're trying to do it on our website. It's a challenge though. It is definitely a challenge. And if anybody wants to join us and wants to help with editing of videos, I've got a lot of videos that are in Spanish that still need to be edited. So love to have anyone join us if you want to, get involved in that, because stories are important and we all know that.
I'm curious what other collaborators and partners you've found within your healthcare team that have really been allies in working on these issues, either through your clinical work, nonprofit, and internationally, especially having that global perspective, if it is different than America or what have you.
So globally, this has also been an interesting journey. We have people from Norway. We've got a big contingency from Greece. We've got some people from Romania, from Italy. I'm trying to go continent to continent. In Africa, we've got people from Nigeria, and I have someone from Tanzania. Somebody from South Africa, but haven't been so busy just because of being busy. Then in Asia, we've got India, Nepal, Japan. Haven't been able to engage anybody from Australia yet, which kind of seems funny. We've got some people from Canada, and South America has been great. We've got people from Argentina, Mexico, Peru. We do have a map on the website that shows the different countries that people are from. In the US, I was able to get some people to partner for my walk. And we have like partnered with Crew, but we are a young organization. I mean, and I didn't really mean to start a nonprofit. That wasn't what I looked to. It was kind of what I evolved into. And so we're growing. We've got some partners. We've gotten the Association of Academic Physiatrists to come be on board and support us. And what we are doing actually is we are trying to expand in certain areas of expertise. So like, for instance, we're doing this course on telemedicine and we're doing Day for Tomorrow, but in November, we're doing a course on what is the best bladder care for people with spinal cord injuries around the world. And we're trying to balance so it has equal consumers and professionals, equal men and women, and equal participants from developed countries and developing countries. And so we're going to start talking about some of those issues as, reusable catheters. Let's hear what they do in other countries and how this is addressed. And that's kind of what we're doing in terms of the Day for Tomorrow, in terms of the disaster issues, is like we did a course on climate change and spinal cord injury and disability a couple of weeks ago for the International Spinal Cord Society. And what they're doing in Japan is really cool. It's like, they've got, what Japan does is really neat. What, the people in Greece have a different idea. Everybody's trying to bring together, the idea is best practices. And it's very energizing to not just be in the US sometimes. I don't know if that answered the question, but there's a lot more to do. And so,
We have a few more questions here. One is, how do you define disability?
How do you define disability? Well, disability is a very broad term. And so as a physiatrist, what happens often is that we tend to get people that have physical disabilities, but certainly in the term of disabilities and in terms of our studies coming up, we want people with mental disabilities. We want people with vision and hearing disabilities. We've basically got like 5 categories: people with musculoskeletal disabilities, and then people with neurologic disabilities. You know, I mean, all these groups are important groups of people, and each group has different challenges. And so, you know, I don't try to define the term. And again, I don't have a disability, but the idea is to also continue to work together as a team. And I do want to say one thing here about like the United Nations. So the United Nations just did come up with this issue of making disability an issue in the human rights part of the organization. So we actually have gotten some people from like Human Rights Watch that have gotten involved. We had a walk in New York and we ended up with the Oculus, which was a really big moment. We ended up with the Oculus and we had the Commissioner on Disasters with us, the Commissioner of Disability, and we had a couple people on the City Council with us. So it's really just, you know, kind of, we're growing organically. That's what we're doing. And I'm just going to take it wherever I can take it. But I think the thing is, we've all got to go towards the same future, think sustainable, think equality, and think rights together.
And Mona says, how do you suggest that other health professionals bring these issues forward in their communities? Have you put together an issue brief on this topic? Is this something you would consider?
It's something I would love to have Mona's help on. I'm not right now. We are. So I had told some people before I stopped working to do this, and as the primary breadwinner in a family, you can only not work forever. So I'm doing a locums for a little while. And actually, I'm in New Orleans and seeing straight on what climate refugees look like on the streets of New Orleans when people have relocated here after, I don't even remember, I guess it was Laura. So right now we want to get these programs going and continue to grow. We try to talk, I've talked to everybody that's volunteered one-on-one. We've done like a one-on-one Zoom call. And what we do then is we have, every 2 weeks, we have a meeting about what we're doing. So I think that's a good idea in terms of issue briefs and moving together. I do have a goal to have a, one of the frustrations I have is that people in climate change don't really seem to want to return our calls. And it's hard to get this group together. People tend to think disability, climate change, and you know, it's a powerful combination. And so we've got to keep pushing to make that combination. And I think it's going to happen with time. But right now, I think we have to get past November and you know, then regroup and go ahead, however we end up having to do it. And Felix, I'd love to have you participate. That would be awesome. I'm going to take a picture of my screen, but.
Yeah, we'll follow up with an email as well.
All right.
Yeah, we would
so
be
much.
happy also to facilitate, to help with putting together an issue brief.
Thank you, Mona. That would be great.
Yeah, you know, we are increasingly focused on policy change, and we have a template already for issue briefs, kind of an outline of what should go in there. And so, yeah, we would love to speak to you about it.
That'd be wonderful.
All right, we're getting to the top of the hour here, so I just want to welcome you to leave participants with one or two final remarks and recommendations on what we should take away from today.
From me, I say, just remember people with disabilities are the most vulnerable. Be creative in what you do. Think about, you know, online things. Consider looking at Day for Tomorrow and Sustain Our Abilities, and just incorporate it in your practice. And please get everybody you know to vote. I'm sorry that's not on topic, but it's the underlying message we all have to give right now. Thanks, everybody.
Thank you. And you'll see the CME link in the chat box. And you'll also get an email reminder. So thank you so much. Wonderful.